All right, Dr. Galalo and Dr. Sardi here talking today about one of our favorite exercises for hip stability. All right, this is called the Bulldog exercise. There's a lot of different ways to do it, but this is how we do it here in our office. So we start in the quadruped position here. The patient or individual's arms are stacked, hands are stacked right underneath their shoulders. They're going to kind of reach through the ground with their hands, kind of twisting the floor, trying to screw their hands in the ground, stabilizing the shoulders and the upper back here. Their knees are going to be stacked underneath their hips. They're going to kind of push to reach their knees through and kind of pull their knees apart, almost like we're externally rotating, kind of like when we're going into squat, and we're kind of driving the knees out a little bit to activate the glutes. And then they're going to set their rib cage and pelvis to a neutral relationship, so keeping tension in through here. From here, they should be very stable. Shouldn't be able to move them very much at all. Now, from here, we're going to start to work on engaging those hips and those external rotators. So we're going to work on this hip here. So she's going to keep that tension in this hip and tension through the upper body. She's going to slowly lift this knee out to the side, making sure her pelvis stays square to the ground. If it helps, we can tell the athlete or coach them that imagine like they have a flashlight coming from their belly button, shining straight down on the ground below them, and they need to keep that flashlight shining here. This kind of keeps their pelvis and their lower lumbar spine kind of staying stable here. So they can squeeze from right here, drive the knee out to the side, keeping the pelvis nice and square. Sometimes it's a very small movement, but until you can learn to have better control and better strength in this muscle, that's all we're going to get. We want to make sure we keep this pelvis nice and neutral here. As a little biofeedback tool if you want. If you don't have a person here coaching you, you can put either a wooden dowel or a foam roller across the low back like this, and this serves as a little bit of a feedback tool when they go and raise this hip out into abduction to whether or not their pelvis is rotating. They'll feel this kind of shift back and forth. We can even make it more difficult if we align it like this. It'll start to shift and roll back and forth this way.